are from Almaty, Kazakhstan, and Happy Navruz. It's a new year in nomadic countries, in Turkish countries, in India, and I hope it's a huge territory. Ничего не бойтесь, лежите хорошо. Я здесь, Mynzhylky Sailovich. Ага. Я здесь, да, я здесь. Mynzhylky Sailovich. Ага. Здесь я. Гепарин, атропин. My assistant is Shaykh Shurikhanova, Mohammed Khan, and we are neurosurgeons. This is the neurosurgical department, and case number 1 for today under local anesthesia. Young gentleman, 74 years old, with the diabetes and the twice stented coronary arteries. Enzo, hello. With twice stented coronary arteries, and now he's preparing.
Suffered from stroke?
Yes, it was stroke one year ago.
Yes.
Okay, 1 year ago, on right MCA territory. Yeah? And patient has chronic occlusion and a slight hemiparesis on the left-sided hemiparesis, and now patient is preparing for coronary bypass, and our cardiology colleagues asked to prepare brain for the pump-assisted coronary bypass. And let's see the circulation. Unfortunately, today we have no protection devices, but fortunately we have CGuard from Inspire MD. This is chronic occlusion on the, this is brachiocephalic trunk. Right vertebral artery is here, no problem. Chronic occlusion of the right ICA, but I think it's possible to open naso-orbital anastomosis in place. It's working, and but patient has okay, it's a vertebral artery territory, and PCOM is in place, and PCOM is taking care for right MCA territory, and also patient has a okay, vertebral is normal, and A1 is present, and it's also nice to have ACOM and PCOM, and I think there is no need for bypass on the right side, and I think there is no indication for recanalization. Yeah? I hope my neurosurgical colleague Ahmed will agree with me. Atropine, Geparin. I'm asking for atropine 1 cc. Atropine, Geparin.
Yeah, atropine.
It's 8 French guiding through the 8 French sheaths. And we took a Xeon blue coronary wire. Judkins right. This is Judkins right. And coronary wire, Xeon blue, and okay. Let's place wire up, and CGuard from Inspire MD company. this short length, 30 millimeter, and I hope this portion is okay. The negative part of cigar, it may jump, as all self-expandable stents, and yes, this stent is also jumpy, but I think we covered the segment. This was 930, and it's also possible to place one more to cover, because we have no protection device. Huh? Okay. Okay. Let's look okay. And cavernous segment, it's also stenosis. Huh? Okay, let's see. But unfortunately, we have no stents for cavernous. But I think its diameter is okay. Diameter is okay. Let's see. It's not so significant stenosis, but in the future it may cause a problem. 4.4, we will follow this patient and we'll see. This is 2.7. Yes, it's less than 50%, but okay, let's measure. We need a good circulation. 2.7, 3.4. I think it's okay. No problem. Okay, let's open one more carotid stent. Бағыт 9740 ашып бере салшы. Exact 9740. There is no protection device, that's why I am trying to create more dense mesh, and then we will angioplasty. Okay? Yes. On the shelf we have last balloon expandable stent, 215 Ultimaster Nagomi. It's a last for this weekend, and this is the last Sterling balloon, 520. Fortunately for AVM cases, we have all instruments, and my friend Alberto is arrived to the Almaty now with Juan Carlos, I think Juan Carlos, not Juan Carlos, Carlos, with Carlos. They arrived with Carlos to Almaty, and they enjoying coffee in the airport, and they will join us in the hospital in next 30-40 minutes. There is no traffic today because of Nowruz, New Year, and people have vacation, and most of the people outside of the city. It's very nice. Now we created something like it was a stent Crystal Ideale from Medtronic. It was 10 years ago, and then Medtronic stopped producing this stent. It was a hybrid stent. Distal and proximal part was open cell designed, and medial part was closed cell design. To prevent fish mouthing, not fish mouth, the strut of the stent was opened like a cigar, and it was very critical. And also, I think the reason was prevent the emboli, and the medial part was with the closed cell. Так, давай. 6. I'm asking Sheikh Ahmed to give 6 atmospheres. 6. Назад, быстро, быстро. Yes, patient has occlusion on the right side, that's why it may cause TIA during the angioplasty. I think it's okay. Huh? Okay, let's check the AP. Yes, now we create something like a crystal ideale, triple mesh stent with C-guard to protect from emboli and Атропин жасадыңыздар ма?
Атропин жасадыңыздар ғой да? Атропин жасадыңыздар ғой? Жоқ, жаңа жасадыңыздар ғой? Атропин.
Бір кубик, жарты кубик істейсің атропин. Көп керек жоқ. Yes, sometimes atropine is causing dry mouth, and patients start complaining. Yes, now it's better. The first stent was 930, and the second stent inside was 7940. And both stents are with high radial force, and yes, we covered stenosis with the double mesh of C-guard, and then we covered C-guard with the exact stent, and now I hope we can finish this. This one we will follow maybe in next 6 months. If it will grow, then it could be indication for the stenting. Okay, now I will ask Sheikh Ahmed to do last control, and then I will ask Sheikh Ahmed to do CT. That's a protocol. Yes, the brain is clear. Just 1 second. I need to see the brain. Okay. To be sure that Держи, Катя. Перфузики держи. Перфузики держи. Okay. Бұған коронарография керек жоқ па? Жасап қойған ғой коронарография.
Иә, коронарография.
Так, стенты установили. С левой стороны в сонную артерию. С правой стороны артерия закрыта, но ее территорию забирают другие артерии. Так что с нашей стороны мы ее закончили. Сейчас будет томография и поедете в палату.
Куда поедем?
Палату.
Ага,
Ага, с праздником вас.
Вас большое спасибо.
Ага, все хорошо. Все, спасибо. Төрт сквит қоясың.
А узкие правые позвоночные люди нормально?
Там нормально. Okay, dear colleagues, CT is ready. You can see there is a gliosis on the right side after stroke. I think it was emboli at the time of occlusion. And the brain is normal. And the same scenario usually at the time of vertebral artery occlusion. Not all vertebral artery occlusion is symptomatic, but if it's symptomatic, you can imagine such kind of gliosis in basilar territory. It's a real disaster. That's why we are indicating stenting for the V1, V4 segment stenosis. It's not all the time safe to leave the critical stenosis at the time of occlusion. Such kind of emboli, arterial emboli, may happen. And now we will finish the case and see you in 40 minutes. Next case is brain AVM case. I hope Alberto will join us, and for the closed group it will be Zoom connection for the neurosurgeons and neuroradiologists, but you can see the live streaming on YouTube. Thank you. See you.
Спасибо.